Welcome back, and we were talking about the female aspect of the reproductive system. Then part five, we're going to go through the uterine ligament and the blood supply. So there's a lot of ligaments that are going to support that uterus because it has the potential to get very, very big. People have twins, people. Um, and more than that. Anyway, so the uterus is supported by a muscular floor of the pelvic outlet and folds of the peritoneum. And they are going to kind of result in ligaments, right? So these ligaments, especially the broad ligament, that big ligament, is going to have two parts, the mesocelix, the mesometrium, on each side of the uterus. So the cardinal ligaments, right? So these are going to be on the side of the cervix, the lateral cervical ligaments. They're going to support the cervix, keep it positioned. The superior part of the vagina extending into the pelvic wall. So it's kind of a fragile stability there, so that's what they do. The ureterosacral ligaments, sorry, every time, attach to the back or posterior side of the uterus, and they are going to kind of pull between the uterus and the sacrum, right? The round ligaments are going to come from the anterior surface of the uterus, and they're actually going to pass all the way through the inguinal canals and terminate at labia majora. Um, So the uterine blood supply is important to the menstrual cycle and pregnancy. Yes. Yes. Okay. So the uterine artery is going to come from the internal iliac artery. So that's like its main, I don't want to say vein, but main artery. It gives off a handful of little branches, and those are all going to go right into the myometrium, which is the smooth muscle layer of the uterus. And they are going to lead to a set of arcuate arteries, right? So they're going to have an arc and they're going to kind of branch off from there. Each one of these is going to go in like a circle around the uterus, right? Hence the arc. The anastomosis are going to also be part of this kind of like circular structure, this arcuate artery on the other side. Spiral arteries, which are kind of interesting to look at, are going to move through the myometrium into the endometrium. So one idea that the reason they are spiral arteries is they have a little bit more give and push and flex for what can be a very mobile, smooth muscle. They're going to wind between endometrial glands towards the surface of the mucosa and help support that, bringing lots of water, bringing elements, and taking away waste. They are going to help rhythmically constrict and dilate, making those mucosas alternately blanch as well as flush with blood. So they are controlling the blood flow in that area. So here is blood supply to female reproductive tract. So here's aorta, right? So it's like the heart, right? It's totally anatomical heart, right, everybody? Okay, so coming down aorta. So a handful of the enteric branches up in here. Ovarian artery kind of comes off to the side on its own. Interestingly enough, the uterine ones actually are coming off of the iliac artery, so much lower itself. Right, so vaginal artery branches off as well. And so here we go, vasculature to the vaginal artery to the uterine artery. So these are the branch points. And then you can see they splinter off pretty fast into especially the spiral arteries. Arcuate artery, which we talked about, is a little arc, and it's got like lots of little branches over here. The mesosalpinx right here is kind of like a very broad ligament in a way that connects the uterine duct with the ovary itself and a little bit of the uterus. All right, I think that's pretty much it for arteries. So, okay, oops. So I hope that was helpful and gets you oriented. And right, I hope you're out there somewhere having a wonderful day. All right, bye-bye.